Good morning. I hope you can hear me. I know it's a little difficult on occasions in the building, and it's one of those occasions outside today. But a very warm welcome. Thank you to those of you who have made, in some cases, some very difficult journeys to be with us. We're very grateful that you've done so. This is the first event of this kind in Pembrokeshire, and it will, I hope, give you what is an important opportunity for a wide cross-section of service providers here in the county, community and special interest groups, to feed into the first single integrated plan. I'm hoping that it will help us face challenges that we have in the county, and also that it will stimulate further discussion and an ongoing dialogue about how we shape services into the future. And it is the intention that this becomes a regular event and an opportunity for people to engage with us as service providers. The local service board and other partner agencies currently in the process, as I said, of developing a single integrated plan for the county, and by the end of today we hope to be in a position to gauge your views to ensure that the services we provide are reflective of your needs. The background to the single integrated plan, formally there were quite a number of plans, and I'll list them and you'll probably recognise them as I speak of them. The community plan, the health, social care and well-being strategy, children and young people's plan, and the community safety strategy. It's now a Welsh Government requirement, and probably quite a sensible one, that they become one overarching plan for Pembrokeshire. This will hopefully describe the issues that are important to everyone in Pembrokeshire and identifies the approach that the range of organisations will adopt in order to meet those needs. And it is for everyone who lives in or visits or has a connection with Pembrokeshire. So it's for a wide range of audiences, and it's a means, if you like, of communicating our strategies to Welsh Government in a coherent manner. I've often had people ask me what the LSB is, and it might be useful just to touch on that at this point. The LSB was it began as a concept probably 5 or 6 years ago, and it's almost like Total Place, if you like. It's about all the partner organisations who provide public services coming together in a way that's constructive, in a way that it seeks to avoid duplication, and also in a way that seeks to make use of each other's strengths to ensure that we're all pulling in the same direction. The interesting thing is that the LSB in itself does not have any statutory powers. It is the partner organisations who hold those statutory powers, but it's very much seen as an opportunity to unblock difficulties, to ensure that services speak to each other, and to ensure that we do have a coherent plan that ensures the way services are delivered in the county are of benefit to the people in the county. It might be worth saying a few words from my perspective. I now chair the LSB, and in my short time as leader of the council, I found it to be an effective body that provides, if you like, a real focus, and perhaps an example of that would be welfare reform. Because one of the difficulties, of course, as a result of welfare reform will be that some families, around 50 in Pembrokeshire, will be severely adversely affected. And one of the things that the LSB has been able to do is to hone in on those 50 families, to target resources to ensure that we engage directly with them, and to ensure that in terms of local authority services, in terms of police and crime, and in terms of health needs, and social needs from a PADS perspective, we're able to engage and ensure that we effectively nip problems in the bud, rather than waiting for them to manifest and become issues to the services that we deliver. Some of the complicated issues that we deal with makes partnership working an essential element. And social services and health, obviously connections there, child protection and the police, and our highways department and the environment agencies are other examples of that. All of these require positive relationships between different providers who have very different structures in some cases and cover different footprints, but nevertheless deliver to this county, which is, the element that we find so important. As a county council, it's important, and we do make sure that our employees understand that we don't work as a sign-out. That we have partner organisations who, A, may have another perspective, but B, may be better placed to deliver some of the services or even just assist the services that we provide. Please use today constructively. That's what it's meant to be, your opportunity to shape the single integrated plan. It's now my pleasure to call on the Chairman of Hywel Dda Health Board, Chris Martin. Thank you.